Hello, everyone, and welcome tonight. I want to thank you so much for attending our really amazing webinar that we're going to be delivering tonight. And I'm excited because, first of all, having a title, I think, really intrigued a lot of dental team members from just thinking about what we always talk about and just all the other programs that are out there. And we hear from patients all the time, is this the real thing? And that's tonight what we're going to be talking about. This looks too good to be plastic. And so I'm Shannon Brinker. I am a dental assistant. I have been now going on 34 years. I keep saying 34. I'm going to keep saying that for as long as I can. But I am just really excited to be a part of this Learn Tonight, and thanks so much to Viva Learning for just being so generous to me and allowing me to have a platform that I can share my information, and most importantly, talk to so many dentists and their team out there, and especially the dental assistants, because I am a dental assistant. And I want to just thank also GC America for inviting me to talk about one of my favorite subjects, and most importantly, share with you tonight just some of the things that I've done that are good, and I feel like I've learned so much over the years. I was really blessed to work for some amazing dentists, and I mean that. I just learned so much along the way from those doctors of things that they wanted us to do in our provisionals, what some of the patients said. Really just looking at just different materials out there. And most importantly, want to thank one of my favorite people in the world. I'm so gracious and proud to call her my friend, Ava Bojowski, if you're listening tonight. She has played a big part in putting this program together, because one of the things that I will say is a lot of what I learned from trimming provisionals, I have to give Ava a lot of that credit. And she is a dental assistant from Charlotte, North Carolina, but she is from Poland, and just has such an artistic eye and hand that she really taught me just about everything I know about provisionals. So I want to just thank her before we begin tonight, and just jump right in. I will tell you that tonight's program is not going to have a lot of slides, because Ava helped me put this together tonight, and we were really thinking of what is it that can make this presentation different compared to so many presentations that we've done before, but most importantly, what we've put out on Viva Learning. And we just really made the decision tonight to give you really what you need, and that's a step-by-step technique when it comes to trimming provisionals. And I mean that wholeheartedly, because as a dental assistant, we can, be trained on so many things, but nobody really takes us from A to Z. And I will say that this did not come about in just, just one day of learning. You really and truly have to practice, and practice will make perfect. But you also got to make mistakes, because if you never make mistakes, you'll never learn. And so tonight I'm going to share with you some of those mistakes. And again, at the end of the day, we're not perfect. We're human. We do things, that we feel are the best of our ability. But the one thing that I want to leave you with is watching videos like this, watching other people teach you on provisionals, because there's never just one way of doing things. Everybody has something they can bring to the table. And by watching these short videos that you're going to get from Viva, you'll really gain some knowledge. And this is the problem, I think, right now in dentistry, is we don't have enough education. And so I really tell you that, push yourself to get on YouTube and to, not just Viva Learning, on YouTube, watch people, see what everybody else is doing, and most importantly, trying different products. In dentistry, we are creatures of habit with the same products that we've used for years, and stepping outside of that box to try something new. And I will tell you that tonight I'm going to introduce you to a couple of products you haven't used before, and I know that. But one of the things I will tell you is whenever we're introducing new products, give them a chance. In dentistry, and I learned this from Michael Miller many, many years ago with Reality Publishing, and I was one of his editors, his product evaluators, and I thank him so much for everything that he taught me. And he said, Shannon, in dentistry, we have to utilize a product 5 times, 5 times before we can make an honest decision on what we think about it. And so tonight I'm going to share with you some new products and give you some of those techniques. But most importantly, anybody can teach you how to trim a single unit. I'm sorry, but you can get that anywhere. I am not here tonight to waste your time knowing we've got, almost 1,000 attendees tonight on trimming a single unit, right? Get that somewhere else. And if you need that, you can get it again on the YouTube. You can get it on our website. Tonight is about pushing you to do something bigger than that. And if you say to me, Shannon, in my practice, we only trim one tooth dentistry. We only do a single unit. Listen, if I thought that was the only place I was ever going to be in my life, I never thought I was going to leave a huge practice and go to work for someone like Ross Nash, and where we're trimming 10 units, 20 units at a time. Never on God's green earth would ever think that. So don't just assume that that's where you're always going to be, because I can tell you it's probably not. So without further ado, let's get started, okay? The first thing that I want to show you tonight is just really, where are we? What are we doing? When we talk about plastic, patients will tell you, oh, wow, this is just, this is amazing. This is beautiful. And I love those comments. But I'll tell you out of the gate, as a new dental assistant, I didn't get those comments because my provisionals were really not that great. It takes practice. But I will tell you that one of the things that I love, and I hope one day to be able to even do this program for Viva, is putting together a program that I do called When Things Don't Go So Right. And it's the failures that I've made. And unfortunately, this happens to be one of those failures. Now, when you look at this patient's teeth, you'll look at it and you say, a failure? Man, those are gorgeous. These are veneers that were made by Bayview Dental Lab, Shoji Shiruga. He's actually my lab technician. He made my teeth. But Shoji is a master ceramist. He is accredited by the Academy of Cosmetic Dentistry. And he has his work is just beautiful. It's just gorgeous. But one of the things that I will say about Shoji is he loves round. And we're going to talk about that, rounded teeth. And he's from Japan. And so a lot of times when we look at what do patients like, when we talk about, and I can teach you to do back teeth, tonight our focus is going to be on beautiful aesthetic anterior restorations. But this is where I think as team members, as dental assistants and younger dentists, we have to ask patients, what do you like? Now, on a single unit, I can look at the other central and mimic that. But when we get into 4 units, 6 units, 8 units, 10 units, it's a different animal. And this is where we really have to be very specific. The other thing is remember, I told you, Shoji likes round. Shannon likes square. So if you're in my chair and I'm making your provisionals, they're going to be square. I'll sit you up and we can round them a little bit. But from the gate, I love square. And unfortunately, I have a habit of making everything square, right? So one of the things that I will say to you is, when you look at this patient and you're like, oh my gosh, her teeth are gorgeous. I want you to look at the distal of every tooth. And as it goes back, how Shoji opened up those embrasures, okay? When you look at my provisionals, they are, again, I told you they're square. I usually sit the patient up and we'll round them together. But when we look back on them, these were her provisionals, and they're a little bit more square. So when we get into this patient, the day that we delivered her, and she is petrified of dentists, I'm going to tell you, she just freaks out in the chair. She has this anxiety that just goes through the roof. And so we did give her some medication to help put her into like a twilight. And we tried in her restorations the day that we're cementing them, try them in. She says, oh my gosh, they're so beautiful. I love them. We bond them to place. And she comes back 2 days later to talk to me. And so she's in the waiting room and she wants me to come out and talk with her. So I go out and she says, Shannon, I really want to talk with you about my teeth. And I said, okay, oh my gosh, don't you love them? They're gorgeous. And she said, I hate them. And so you can imagine after doing 10 units and, we've got plastic, provisionals, we're going to go to the finals. She's approved these. They've been bonded to place and she doesn't like them. So the first thing that I want to tell you is when a patient says they don't like something, my younger years as a younger dental assistant, I would be fuming at this point because I know how long it takes us to do restorations. I know how long it takes my doctor, and I'm very protective of the doctor. I really am. As an assistant, we know that, right? We're very protective. Somebody says something about, my doctor's dentistry, I take it offensive, but I can tell you that I am very protective of the artwork and the dentistry that we provide, and I believe in it 100%. But you also have to look at it from the patient's perspective. And I'm going to share with you tonight, these are some of the things that can happen. And with this case, she doesn't like her teeth. So the last thing that I'm going to do is change my personality to where I'm going to start being offensive. And so I told the doctor she was there, and I brought her into the room, and I basically sat with her one-on-one and said, tell me what you don't like. And the first step to this that I will say is that I've learned, working with a lot of cosmetic dentists is, listening to what she doesn't like. And most importantly, having an open mind, because there could be something there that she may have an argument for, right? So don't arbitrarily just take it offensive. When we were looking at her teeth, and she said, Shannon, when I was in my provisionals, because Bayview does take about 3 to 4 weeks to make the provisionals. And that in dentistry, we know is forever, right? 3 to 4 weeks. So the patient got used to wearing my square provisionals. And then when Shoji made the restorations, again, remember, Shoji likes round, and feminine, and he's made them beautiful. And listen, people would pay so much money for these, right? But in her eyes, remember, she wore my provisionals for 4 weeks. And here we are, we put in these final restorations, and she's only had them for 2 days, and she hates them. So what am I going to do? So I'm talking to her, and I said, tell me what it is that you don't like about them. And she said, they're just round. I feel like they look like, and this is exactly what she said, they look like canines. I feel like the 2 teeth, and she's talking about not the centrals, but the lateral. She said she felt they looked like canines. And I said, canines? I said, they don't look like canines. I said, these are canines. They're pointed. She said, yeah, I feel like they look the same. So she said, I just really liked my provisional so much better. And I said, well, they're very flat, they're monochromatic. And I said, and they don't have this life that the final porcelain has. And she said, no, Shannon, again, they're round. And this has so much space in between these teeth that I feel like they're more pointed. So I said, okay, well, let me do this. And I really did not ask. This was when I worked with Ross Nash. I've worked for John Cranham and the Dawson Academy for many, many years. And this happens to be one of our patients with Dr. Cranham. And he was with a patient, and I was in here with her. And I said, well, let me do something really quickly. So I pulled out my composite that I had. And this is Genial Sculpt from GC. And I love it because it's really, to me, I almost compare it to frosting. I can just take a little bit of it out of the tube, and I do like to use syringes, I'll be honest. And it's really easy to maneuver with your fingers. And I just took it, and I basically just added a little bit of composite on the distal of her canine. And then I was like, okay, well, I'm kind of liking this. Let me add a little bit on the distal of the lateral, but I want your eye to go to the lateral here. Do you see? Again, remember what I told you she said. She felt the canines were pointed, but the laterals were pointed as well. And now we know, like, Shannon, what is pointed? Those laterals are not pointed, but what she's seeing is this huge space. The distals are rounded, and she does have a lot of what we call embrasure space. So I took my composite and I closed it in, just like I would have done with her provisionals. And when I did that, I just kind of took my fingers and kind of maneuvered a little bit, took my instrument, and believe it or not, now I don't even use an instrument because this material can just easily be manipulated with your finger. And I tried to close those in. Then I took my putty and I made a putty matrix. When I did that, that gave me almost like a matrices that I could use to fill with provisional material. And this is what we do when the teeth are prepped, right? But remember, she's coming in, she doesn't like her veneers that were cemented. So what are we going to do? So I put the composite on those restorations, closed in the embrasure spaces, and basically made them look a little bit more like chiclets, a little bit more square. I take my putty and I make a putty matrix. I filled it with my provisional material, and I seated it back on her teeth. And I said, is this more of what you were looking for? And she said, yes. that was what I wanted. That was what I had in my provisionals, and that's what I want. And I didn't want these. They're too round. And so from this point on, for the last 15 years, I've always made my restorations in, of course, provisional restorations square. And I always say it's better to round square than to square round, because we could not go back and put porcelain on that patient, right? When they're rounded, you can easily do that in the chair. And taking this case is a prime example of talking to the patient about what it is that they like, talking to the patient about, really having an understanding, but most importantly, maybe we should have paid a little bit more attention to the finals, knowing, she likes them, right? You say, well, Shannon, you tried them in, she likes them. Remember, patients can use that, well, I was kind of, on something, I was in twilight, or I just couldn't see it, these are the things that we really, I think, sometimes have to spend a little bit more time on. A single unit is easy. It's these larger cases where they can come back to get us. And this has only happened a handful of times in my dental career. But I will say, when you think about this patient who is not happy with her teeth, the last thing you want is an unhappy patient, because a happy patient will tell 2 people, but an unhappy patient, they'll tell 10, right? And so this is where sometimes having a better conversation, maybe a little bit more of a lengthier conversation, talking about appointments, which I'm going to go into in just a few minutes, and really taking the time to learn more about shape, not just trimming tonight, is going to help you to be very successful with this. And so, talking with Dr. Cranham, he totally saw what she saw, and she was right. And we both learned a big lesson from this. And so both of us, even though I'm not working with him anymore, this was a huge teaching case for us. And so the best part was, I said, well, Dr. Cranham, at least you didn't have to cut off 8 and 9. That wasn't really funny to him. But, when you look at it, the embrasure spaces were open. And even Shoji said, I'm learning from this too. It's hard to change a hand stroke, but practice and think about this as we get into our trimming tonight. What is it that we're doing? And again, these were the finals. And you may say, well, Shannon, they're really square. I know. Trust me. I actually thought the first set were pretty, but it's not what we like. It's got to be what they like, right? And so this is what happens whenever we're working with patients who are coming in with cosmetics and they want this cosmetic treatment. First of all, they're paying more for it. So we got to give them what they want, and never jumping into just, jumping into things. And sometimes this just happens to us. We get caught up in the moment. And I'll tell you, we learned it the hard way. So tonight, what are we going to learn? We're going to talk about how to fabricate a provisional matrices. And you say, well, that is the easiest thing ever we're going to learn, right? This is something that we really and truly have to think about. And I will say that, the most important piece of the start of any restorative is having a very good preoperative impression. And we're going to get to that. Now, one of the things that I will say is, coming up and having, Tara, she's saying basically here, shouldn't the Ceramis have copied the approved provisionals? So we didn't end up with a patient who doesn't like the restorations. Yes. And I will say that Shoji did copy them. If you look at my provisionals versus, what she had, they were very close. But what I think happened was it wasn't so much, and I'm going to see if I can go back, because Tara, I want you to see this. I can go back. Yay. Look at this. So here's Shoji's finals, okay? Now look at my provisionals. I'm going to go back. You see that? Where I think was the most important piece for her was the distals of the laterals. Shoji, I think, made that embrasure space just a little more of a V there versus what I have, but it's not that big of a difference though, right? And this is where the photography is so important, having the photographs to look back, because even though, again, we look at it, we're like, well, shoot, Shoji basically did follow the provisionals. Mine were a little bit more square, but I think it was that embrasure space. And so, I'm with you on this. You would think everything we did was right, but, sometimes going through it, having the photos to look back, we probably would have done a few things a little bit different. But again, looking at that embrasure space, That was something that, she definitely is. Now, listen, these are very square compared to my temps. Okay. I would not have made them this square, but I think it was the opening in the embrasure space. So thank you for asking that question. How do we trim and finish? Tonight, we're going to talk about disc. We're going to go through and talk about the difference in burrs and what a difference that's going to make in your final, trimming of those provisionals. When I say not final, but the trimming of your provisionals, because we're so used to using certain burrs in dentistry. And when we're trained to use a certain tool, we know we're creatures of habit, right? We don't like to change very many things, and we'll try something, but we find ourselves backing up and going back to what we used to use. And tonight I want to kind of show you a couple of things when it comes to those burrs, okay? And then most important part of this whole thing is utilizing a really good cement too. I don't want to not think about that, because this is where the number one thing that I'm asked from dental assistants is, what provisional cement do you use? Because our provisionals are coming off, and we're going to get into that as well. And I'm going to walk you through a couple of different cements and when we use them and why. Okay. So let's get started. When we talk about the preoperative, when we get into these bigger cases in our practice, we had a rule, 4 or more units. We always have what we call a preoperative appointment. And that is not with the doctor. That's with the assistant. The doctor might pop in, but I can tell you, this is where we want like 30 minutes. Let's have a conversation again about color. We want to talk about, maybe do we want square? Do we want round? Sometimes I'll even take a recording of the patient, what they like about their teeth. What do they want to change? And we have a huge learning module on this just from lab communication and the things that we need to make these cases amazing, because that could be lengthy compared to what we got time for tonight. And the other thing is getting some type of deposit down. In my practice, we used to have the patient pay us a deposit, because if they paid a deposit, we know we're going to, we got lab bills and everything else, but most importantly, we knew they were coming. And so that's something to think about. If you got these patients, when you think about 4 more units and they don't show up, what are you going to do with all that time? We can fill it, but we can't fill it last minute. So these are the things that I want you to think about. But most importantly, that preoperative appointment is going to help us with shade and shape. And when I say shape, these patients will come in and they're going to say, well, Shannon, this is how I used to look, and I want to look like that again. And I'm like, well, that was 25 years ago, right? I can't tell you how many people I would love to come in and say, hey, I want to look like this, But this came from Elliott Mechanic. Now, I did take it and change it just a little bit, but I would tell you that this is something that I will give to Viva, so you can download this. All you need is a central, lateral, and canine shape. And what I do now for Shoji, I circle it. I print it out, and every lab case, I circle it, and it goes straight to the lab with my box. So this way they know, hey, we want square centrals, we want this, we want that. Because if you ask patients to bring in photos, they're going to give you a million photos. They're going to be all over the place. This is something that, again, you think about, it makes it so much easier. And if they want to bring a picture, have them bring one. Because I had a patient one time brought 6 photos. I would have never thought in a million years that this patient would want more round. And so this is where it will really help us to have that. Now, I want to just touch on a couple of things when it comes to impressions, because I mean that wholeheartedly. The better your preoperative impression is, the less trimming. If you say, Shannon, what's the secret to cutting down this trimming? Now, there's no secret. Take a good pre-op impression, a good, detailed, on-point impression. Whether it's an alginate, yes, alginate, we can't really mess it up, but I can tell you that I like to use PVS. Why? Because I can pour it more than once. I really get a crisp, clear margin. I don't have to worry about it. And I hardly have to touch it. And I'm going to prove it to you tonight when I show you this. The other thing is that, I like the fact of utilizing it, but I will say that, Ava, my partner, who has trimmed just as many provisionals as I have, she likes to use a coping stent, because not only does her doctor like to see through it and see the prep, make sure he's got enough reduction, she likes the flexibility of using a coping stent plastic. And so we'll show some of that. So if you're using alginate, I want you to know that this is an alginate that GC has come out with, and I didn't even know that they had this. And this is a wild cherry, and I can tell you it tastes really good. Not that patients want to eat it, but I want to show that. So if you're using an alginate, I'm not here tonight to to make major changes, but I do want to showcase the fact that they do have better flavored products, because we know that in dentistry, everything tastes bad, right? If it tastes good, I think they think we won't use it. So want to mention that. But I will say that when I'm doing a case like this, anything that is a big case, I want polyvinyl. Why? Because if they break it, I can go right back and remake it in a couple of seconds, right? Versus, when we got alginate, you can only pour it one time. This can be put in a baggie. We can save it. We can add to it. You just never know what can happen. And again, can be repoured multiple times. I also like to show Shoji, this is what we did. Here's an impression of her temps. And now we even have patients come back and approve the temporaries a couple of days later. We have what's called a post-op provisional visit, where they come in and they approve them. So this way we can take an impression and send it to the lab if you don't have a scanner. And I have a scanner too, so I know it's a different day and age, but there are times when I'm going to be taking an impression, but especially for a provisional. So something to just kind of think about, if you don't have a scanner yet in your practice, this is a really good material to utilize. And again, so many different products out there, but looking at the detail, I can tell you that this is a great product from GC, and they actually just launched a brand new impression material. And so, again, Exafast is one of the ones I've been using for a very long time, but I love the contrast of those colors. And when we look at, the difference in price, if you think about alginate versus a polyvinyl, it's about 60 to 70 cents more an impression. So we're getting really good detail. But what I want you to look at is when we have polyvinyl and we can utilize just a light body around the tooth that the doctor is going to be prepping, it's going to be flawless. I'll take a 12 blade, cut it, put it back in, make my single unit, and then making sure that, again, I've got really, really good impression. And if you want to use a coping stent, you can use a suck down machine. You've got to pour it up in stone, make a suck down. I'm going to show you that tonight. Ava loves using the coping stent. It's another way to do it, right? There's no right or wrong. It just depends on what you want to do. Now, I want to introduce you to Temp Smart. And Temp Smart is a material from GC America. And I can tell you that I've been using Temp Smart now for about 5 years. It is very, very strong. And when I say that, you'll notice that the impression gun the gun is basically the same as what we would utilize in an impression cartridge. It's not what we call, those 3-to-1 cartridges. This is a 1-to-1 cartridge delivery. And so what does that say about this material? It has a little bit more of that acrylic. It's a harder material, which you'll notice right away. When you start to trim it, it's hard. You're going to see it disperse here in just a few minutes when I show you the video. But one of the things that I feel wholeheartedly about this product is it is strong. So when we talk about more than 2 units, 4 units, 6 units, we need strength. And especially for patients who are bruxers, clinchers, they can break this provisional material. And so this is a very hard product. And you'll see that here in just a few minutes. It comes in a lot of different shades, which is great. I can tell you that probably the number one shade we use is this one right here, this base white. But a lot of different shades. And the other thing that I want to back up real quick, and I apologize, is that it really and truly is great to have the same gun. You don't have to have the 3-to-1 gun. But I also want to mention that they also have, if you're short space in your practice, you can use you can order the smaller syringes of the provisional material. So I just want to make sure I didn't forget that for you. When we're loading these products, one of the things I see a lot with assistants is lifting the tip out of the material. When you go to load, you always want to make sure that your tip is in the product. When you lift it, you're going to get a bubble. It's going to happen. And so this is one of the things you have to pay attention to as an assistant. When you're loading, keep that tip in the material. Everything that I teach, I want it to make sense to you. So when you lift it, you think about it, you lift it, you just created a bubble. So one of the things that we're going to do is we're going to keep that tip in there. And I like to make 3 passes. I'll go right to left and then back to right again to make sure. The other thing is that we always want to extend our provisional material over one tooth. So if I'm doing 7 through 10, I always want to go and start loading 6 all the way to 11 and then back, because the last thing you want to do is not have a good contact. Okay. And so that's something to think about. Now with this material, you really want to think about what is your setting times and what's your working times. And I can tell you that, when we think about starting to set, you really and truly want to look at how long is this taking. And so when we, extrude it out, it's going to take about 45 seconds to start to get to this gel state, a harder gel state. And we've got a working time about 45 seconds. And then the setting time is going to be about 2 to 2.5. And so this is where, I want you to, again, also know that this product barely even gets lukewarm. And there's a lot of acrylic out there that actually gets really hot and then cools back down. Just when I told you this one has acrylic to it, it doesn't mean it's going to be warm. So just kind of know that. Burrs. This is one of the things that I really do want to make sure that you understand tonight, that we're using different burrs. Now, these happen to be burrs from Brasseler. This is a kit that I designed. I get no money from this. I only designed it so you could find the burrs, I'll be honest, because it's so hard sometimes to know all these numbers. But I will say that, one of the things that you will see tonight, and you'll have this, is that you can go back. Notice the burrs that we're going to be utilizing, and I'm going to showcase those. We've got what we call a safe-sided diamond disc. We have a disc that has these little holes in it. It's called a perforated disc. We have polishers. We've got a goat hair, which is the hairbrush with the gold on the inside, and then that big muslin wheel. And I can tell you, those are the 4 burrs we're going to use tonight. We're going to use safe-sided, the perforated flexi. We're going to use the goat hair brush and the muslin wheel. And then we're going to use these sandpaper discs to the far right. I'm only going to use the sandpaper disc. It's an extra fine garnet from Cosmodent. We're not going to use any acrylic burrs. This is it. When we do anterior, this is all you need. And I know, listen, you say no acrylic. What about Big Bertha? Well, guess what? Big Bertha is never going to give you the contours that you need to fabricate beautiful anterior aesthetic provisionals. It's just too big. It's too bulky. This is for dentures and partials. We have to have a different way of thinking. We need disc. We want to open up embrasure spaces. We want to make these teeth look like single units, even though they are splinted together. We also want to think about what discs do for us. It thins out the material. And this is what lab technicians use. And so makes sense, right? We're not using that Big Bertha, look at Big Bertha versus what we're going to use tonight. The other thing is talking about, utilizing a rubber clear coping stent. This is a coping stent. Ava loves using this because she feels like it's very flexible. But I will say to you that for me, I like to use putty. I like to use putty. I'm very different in that aspect. But I understand why she likes to use it, because she can see through it. Again, it's flexible. The other thing is that you can see if you maybe have any bubbles or any areas there. But most importantly, her doctor likes to use it because they can see the reduction. You can use it for a reduction guide. Now, remember, I said that this is about a working time of about 45 seconds. It's going to start to gel. This is outside the mouth. So, of course, it's not as warm as it would be inside the mouth. So you always, as an assistant, want to make sure you put a little drop of that on your tabletop. And the way to check it is being able to take your Explorer and go in and out, in and out. If you can put that Explorer in it and it comes out clean, we're golden. But I'm a timer girl and I want a timer. And I set a timer for everything because that's what my dentist wants me to do. And so I really and truly want to make sure that we don't pull this too soon. So, the more you use a product, the more you're going to get used to it, and you'll know when that gel is going to be ready, right? We don't want to pull it too soon. Now, as we go and we're pulling it out, you'll notice that it's a little bit, rubbery. We're able to flex it right on out of that coping stent. It's the same thing because it's still in a rubbery state. At this point, I will also put it back on the prep. And I will say that sometimes I'll go ahead and put it back on the prep just to make sure that it's fully set. But what I love is I want you to notice it's not as sticky and gooey as a lot of other provisional materials. It has an exothermic, layer, what we say, that stickiness. I call it exothermic reaction. But I will say that notice it's shiny. You see that already? This is why I think this product is such an amazing product, because we have this shine, this sheen. You're not going to spend a lot of time having to polish this or use pumice. And I'm going to show you that here in just a minute. Now let's jump to trimming. We talked about the safe-sided diamond disc, right? That's what we're using first. So we've got our 6 unit. You can use your fingers to kind of break off some of the extra material. But the first step is we're going to make these look like single units. Now, you'll see here just one pass. This burr is only to make the teeth look like single units. This is not what we're going to be utilizing for trimming. We're coming straight down. You see that? We're opening up the area for the papilla. Straight down. It's like peeling a potato. If you can see, we're holding it. It's a palm thumb grasp. Peeling a potato. Don't have really big gloves on or it's going to catch, okay? Discs are very different, so you got to take your time. Listen, do you hear?
One unit, it looks like single.
Do you hear the drill? I want you to listen to that because, again, it shouldn't be up too high, but we want enough to where we can make it. Again, we're going to go in just a little deep, straight line, straight line. Palm thumb grasp. This is not a pin. If we were using a pin grasp, it's going to jump, okay? So just making sure of that. And again, going back, I want to just make sure you see it. Peeling a potato, straight. All the way to the papilla point. All the way to the papilla point, okay? Not too deep or you're going to break it, all right? So we're going to go on the facial embrasures. Sometimes I'll even do lingual, but we're going to focus on the facial and open up the papilla point straight down. Second burr, we're going to jump to the sandpaper disc now. Okay. Now the sandpaper disc is where we're going to go to our margins. We're going to just dust that contact. Now the beauty of utilizing a material like Temp Smart is we can add to it if we wipe it out, but you just want to dust that contact, okay? Watch the sweeping motion of the sandpaper disc. We're going to start in the papilla and round. Start in the papilla, round. Go to the papilla, round. Okay? Just dust, dust, dust. We're not using Big Bertha here. We're letting the disc, it's a soft, extra fine garnet. It's a 3/4 extra fine garnet. It's big enough to where we can just almost drag it across. But again, painting motion, right? Not digging, just sweeping. And we've got a little bit of a ledge there on the distal, so we're going to smooth that out. Take your time. As a new assistant, one of the things that Ava and I both did when we started learning how to trim these is we would always, if we could, make 2. Why? We could practice, practice, and practice. But disc, remember, we use that safe-sided disc to open up the embrasures, and now we're going to go back and just gently take our sandpaper disc and smooth, smooth, and smooth. And you notice we're turning it around, looking at it from different angles. This is what lab technicians do, right? Now, first thing I said, disc is going to open up those areas where the papilla is. We're almost just coming straight down, straight down, straight down. Again, going back to what we said, we're making them look like single units so they don't look like they're one big chiclet. But don't go too deep because this is a safe-sided diamond disc and it can go into that provisional and break it. Ask me how I know, okay? So I want to just make sure you see that. But notice it's a straight line. You follow the tip of the papilla point straight to the incisal edge. Do you see that? Because if you don't go straight, you're going to make a cant in your provisional with that first hit of that disc. So again, this is just to make straight lines. That's all this disc is for. This is not a trimming disc. This is to make your straight lines. Now, let's go back to the sandpaper disc again, okay? Remember, Ava is trimming here the distal, sweeping motion, okay? Sweep, 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 sweep. Thinning out right at the gingiva margin, right? Thinning that out, making sure, again, we're just dragging it and dragging it, okay? Are you guys seeing my video here? Looks like you're not seeing it. Is everybody seeing my video? I'm seeing your video or anything you're talking about. Do you guys not see that? Let's see. I'm seeing the video. Okay, somebody says they're seeing the video. Okay, I just want to make sure because they're saying they don't see the video. Kelly is saying I'm not seeing your video or anything you're talking about. So Kelly, you may just not have your camera where you can see that, but it looks like Shamara is saying I'm seeing the video. Okay. So Kelly, check it on your end. So anyway, so this is where, you know, again, we're sweeping, rounding, just making sure, again, just barely stroking it, right? Just making sure that we can, you know, just let it follow. And again, to me, this is the most important thing that we need, right? As assistants, somebody needs to show us better burrs, better technique, smooth, and just making sure, you know, and again, you may say, well, Shannon, I've never used these burrs before, but taking your time, you know, this is very different. You may not have ever even used these types of burrs. The other thing is if you're using a high-speed, you know, handpiece, this is something where I want you to really think about. If you're using a high-speed handpiece, we don't really have this kind of control. And I get scared when I hear assistants saying, well, we just use a high-speed handpiece to trim our burrs, trim our provisionals. And I'm like, wow, I'm really worried that, you know, are you really, you know, utilizing the best practices here? And I will tell you that every team member, every dental assistant that's on my team, when we're teaching assistants, all of them who are trainers, we all use discs because we're able to really define these areas and just really make these beautiful. And with the sandpaper disc, and you need both, you need the safe-sided, you need the perforated disc, you need the sandpaper disc, because we're starting, you know, to make line angles, and then we're going to define that, and then we're going to jump to a sandpaper disc to smooth it out. And again, I want Shoji to follow, because when we don't make really nice provisionals, I want to show him, hey, listen, this is what we've achieved, and you better do just as good or better, right? But notice we used the safe-sided disc first, and now we've got this sandpaper disc that we're able to go into these interproximal areas and really smooth this. We don't have to worry about blunting the papilla, and most importantly, making it really hard for patients to, you know, keep that gum tissue healthy for us, because we can't bond to blood, right? Doctor can't bond to blood, so we got to make sure of that. Now we're going to jump to our favorite burr. Ava and I both love this burr. This is a perforated little disc. It's very similar, and I would compare it to, you know, our disc that we're using with sandpaper. But notice here, we can go back, we can flex it a little bit more. And again, the one thing about them is these are not cheap, so you know, you want to take good care of these and put them into a burr block like the Burr Butler, where we can put the whole burr block into the autoclave and autoclave it and take really good care of these. These burrs are about $24. So they're gold, right? Golden. And I love using them though. I mean, just look at how she's able to, again, we're peeling a potato, right? We're letting the burr do the work for us and just going back and forth, back and forth. And again, you think about what I said, we're going to open up these embrasure spaces, come straight down. We're going to then jump to the perforated disc, and this is what it looks like. We're going to grab it, drag it, grab it, drag it. Not Big Bertha, okay? Not Big Bertha. Once we have that, one of the things that we want to make sure that you understand is how to polish it. Now, I can tell you that, you know, you can use a lathe, you can use pumice, but Shannon is not that good. I am not super assistant when it comes to using the lathe, because I can tell you how many times I've tried to polish my provisionals with the lathe and end up breaking them. So I love these too. And with those, I don't have to do that with this material. You saw how pretty it was, how shiny it was. It worked beautifully. So you really don't have to do that. But I do want to share with you.
You can actually burn your provisional, and ask me how I know, because I've done that, right?
Turn it up too high, you are going to burn it.
I want to turn it a little bit higher than I did with my sandpaper disc and with my safe side diamond disc, because I do want to make sure that it's a little bit higher. Now, holding that provisional, okay, you see how it's really just moving, 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 moving. Think about the lathe. If you're going to use that pumice, you know, now this is not the high shine. You may already notice that, right? But what I'm doing is I'm removing any of those little particles from the sandpaper disc that I might have nicked the provisional with. That's the purpose of the goat hair brush, okay? Palm thumb grass, you see how I'm holding it? I'm really getting in there with this brush. See?
And again, don't turn up too high because you will turn it black. You can get it off, but it's happened to me before. But think about it. You get your shoes shined, right? You got a wheel going back and forth, back and forth. Just think about going to get your car cleaned. Go back and forth, but watch the shine that's happening. You can't just, if you're going to use any type of glaze, GC has some amazing glazes out there, but I don't want to just jump to a glaze. I want to polish it first because patients can still feel the bumps and grooves on that facial surface. So going back and forth and making it really nice and shiny and smooth, because once they touch it with their tongue, again, when we're swallowing on the lingual side, I want it to be really, really smooth. And it's amazing how you will say, well, Shane, it really doesn't matter. I polish it good enough. But guess what? When that's in your mouth, you'll be surprised at how rough it will feel. And I know that firsthand because every tooth in my mouth is porcelain. So this is why I really and truly take extra care with polishing it. And I love these polishers. And these are from Brasseler, beautiful polishers. And what I want you to look at is this is what we must see. And this is a provisional, happens to be mine. And look at exactly what you see in between every tooth. They're still splitting together for strength, but we need to have them nice and round, beautiful margins, nothing that's jagged. Again, using the disc, but most importantly, looking at how beautiful this product is. And again, having a product like TempSmart where we got all these variations of shades, because listen, people don't want A1 anymore. They think B1's yellow now. Having this color is still absolutely gorgeous. Now let's talk about cementation before we close here, because this is probably one of the, again, going back to the number one question other than burrs that we get is, Shannon, my temps keep coming off. Well, the first thing you always want to do is make sure no matter what provisional you're making, I don't care what product, what brand, I always micro etch the inside before we seat them, before we cement them. Why? We want mechanical retention. And this happens to be a little micro etcher. So make sure that you are micro etching them. If you say, Shannon, I don't have a micro etcher in my practice, you can take a little diamond and roughen up the inside, but we need retention. Now, one question that Alexandria had, she said, what about the burrs? How often should you replace these burrs in the burr block to polish the temporary crowns like the disc? Now, I can tell you that the polishers that I use from Brasseler, the white one and the goat hair brush, oh my God, I've had them things for like years. And we teach a bazillion provisional courses. Those you get in like a pack of 5, they'll last you forever. But I will say that those perforated discs, they'll last you a really long time. You just can't lay that handpiece on a tabletop and not take them out of the handpiece and put them back in the burr block. We're teaching courses, and I can tell you the first thing I see is assistants sit that disc down on the desktop and they break it. So that's where, safe-sided disc is going to be a lot more sturdier than that perforated one. Can you just use a sandpaper disc and the perforated disc? Absolutely, you can. Those are disposable. So, but I'll tell you, Ava and I both, we love those perforated discs. And it's almost like once you use them, you'll never use anything else. But you got to take care of them. They'll last you quite a while. I mean, I would say a year. So if you're spending $24 and you get a year out of them, but treat it like it's gold because it's very valuable. And I would tell you, you'll do an amazing job. When I have veneers, again, look here, you can see I actually blocked out the background so you can see the micro etch in those provisionals. We micro etched it, right? That's important. If you think about when you're cementing a tooth and the crown comes off, if the crown comes off or temporary crown comes off, where is the cement? Is it on the tooth or is it in your restoration? If it's on the tooth, the cement's on the tooth, there was something on the tooth that inhibited that cement to bond to the restoration. So which tells us that we really and truly need to make sure, and I just don't even worry about it anymore. I just go ahead and micro etch every internal surface. So you don't have that. And I'm gonna tell you, when you do this or you roughen it up on the inside with the diamond, now don't dig into the inside, just roughen it up. So you've got, again, that mechanical retention, you won't have it. So when we're doing veneers, one way to cement veneers that I love, we used to etch the tooth, spot etch the tooth, rinse it off, and maybe spot bond. You don't need that anymore. If you just have veneers, you can use Genial's Universal Flow. This is like cement. And I'm going to tell you, it's beautiful. It looks good. All you have to do is just add a little bit of that flowable to the internal surface. Now, again, micro etched it, right? Why do we micro etch it? We want this, injectable composite is what we call it, to bond to the Temp Smart, and they're made to go together. So this is where, you can add a little bit of flowable to the inside, seat it, just seat it right on the tooth. We're going to take a little brush here. This happens to be a little Keystone brush. We're going to wipe away the excess and make sure we got really nice margins. A lot of the cleanup is done for us. We don't want to just put too much in there, but wiping that away, cleaning it up, and then curing it. So that's one way to cement. Now, if you said, what is your favorite cement? This has nothing to do with GC, nothing to do with any other brand. This is the #1 product in my book. And I can tell you that even in my own provisionals, this was all I use. And I'm allergic to a lot of dental materials, and I'm allergic to resin ionomers, glass ionomers. I'm allergic again to a lot of products. But guess what? I did not care if I was allergic to it or not. I wanted something that was going to stay put and stay on. And this is the first glass ionomer provisional luting cement. So if there's nothing you buy tonight, this is the #1 product you got to get. Now, the downside is I'm hoping one day it comes in a syringe, but right now it is still in a clicker. But I will tell you, do get more bang for your buck with the clicker, right? We know that. And we don't mind as assistants mixing something as long as it is strong and it's going to stay on. And I can tell you that these temps don't come off with this product. So keep that in mind. I love it. It does take a little bit longer to set. And I will say that it's about a 3-minute. But remember, it's a glass ionomer temporary cement. So it's an amazing product. I cannot say enough. It's my favorite product GC has. I use it for everything. My crowns, my bridges, implants. I also love their little gripping instrument. This is an amazing instrument because you can put these little yellow feet. Now, I'll be honest, and hopefully GC won't get mad at me, but I like using this, and we don't even use the little yellow grippers anymore. But this is a great way for us to remove the temporaries as well. And beautiful product, because there's so many out there that give you this moon tooth, and I hate a moon tooth. So I do like the fact that we can do that. Now, one of the things that Sandy asked is, what if there's a composite buildup? Isn't there a chance when you remove that buildup, it could come off with it? You could, Sandy, and this is when I would not use, and I'm glad you said this, because I would not use a flowable composite. I would use this. I'm going to use this product from GC. Now remember, or I'm going to use the Fuji, but I will say that when I've got a lot of buildups, we've got a lot of broken down teeth that we had to build up, their Temp Advantage is something that not only can I get off quickly, especially even if it's a case that we're only going to cement for a few days, or maybe the patient does have a lot of buildups on every tooth, or a big undermine buildup, this is where I'm going to go. Because remember, the Fuji Temp LT is very, very strong, and those teeth are weak, even though we did do really nice buildups. And so I'm so glad that you asked that. So I like, though, having more than one cement. And I think this is, again, where we get into trouble in dentistry, where we just have a one-size-fits-all. And so if you think about it, if it's veneers, I don't want to put a big white cement on the back of those. I really want to try to bond those almost to place, no pun intended. Now, I'm not etching, and I'm not using bonding agent. I'm just using flowable, so it basically attaches to the veneer provisionals. I don't use a flowable under crowns. I'm only going to use that for veneer temps. When I go to a crown, a molar, or a central, and I know, again, I told you Shoji takes 4 weeks, I want something very, very strong, because the last thing that I want is for a patient to come back and say, yeah, that girl made those temporaries and they came off, right? I don't have that anymore. So I do want to use my Fuji Temp LT. But if I have something that I'm worried about, and again, as assistants, this is where we got to put on our eyes and really think on the lines of, okay, well, we just did a bunch of buildups in these teeth. The last thing I want is to pull those buildups out, right? And this is where I'm going to use the Temp Advantage. And it's more on the lines of a very universal temporary cement that we're all used to using. I still feel like it is a little bit stronger than the other brands out there, hence, like Zone or Temp Bond. I really do like using GC's products, and the brand really speaks for itself. And it's not even about them sponsoring tonight. I went to them. They don't come to me when it comes to using products, because I'm not going to change my PowerPoint for money. I'm going to tell you about the product because I use it and I have it in my own mouth and I know it works. Because at the end of the day, it's not about the money, it's what's best for my patient. Because when things go wrong, they might blame the dentist, but I'm the one fabricating the provisional. So I treat it just like it's my patient, it's my practice. Even though my name's not on the door, it is still my patient. And that's how we feel as assistants, right? I mean, you guys feel the same way, or you wouldn't even be on this webinar tonight. So think about those products and, making a choice, when you look at, what, yes, it might be a little bit more expensive for the Fuji Temp LT, but guess what? They don't come off. And I would rather have a temp that doesn't come off than one that comes off one time, 2 times, 3 times. I mean, because what do we know? We know that when something comes off one time, it's probably going to come off again, right? And you're like, man, you see that person on the schedule and you're like, great, what a good Monday, right? But this is what I mean by that. The other thing is when they're splinting together like this, I like to take floss and floss through those interproximal contacts. So this way the floss is already there, because remember, when we're seeding these provisionals, they're starting to become unnumb. And I know what that feels like, right? And everything starts to hurt all at one time. And so when you get in there with floss, especially if you have a little knot in it, that I like to do, that's old school. I want to go ahead and thread it. So when I hold that provisional, I'll twist those strings, those floss, and seed it. So this way I'm not having to kill myself to try to floss that back through that tissue and then, complain that they're hurting. It's just something I learned a long time ago. It's kind of old school, but sometimes those old school things work, right? So those techniques make a difference. You may say to me, Shannon, I wish that I could learn more about trimming. I can tell you that, right now in this day and age, there's not a lot of courses out there where we're really learning how to trim and better ourselves as assistants, and moving ourselves up to that next level and really learning how to fabricate beautiful restorations. And I can tell you that when I thought about the title of this course, it's something that patients will say to you, this looks too good, or Shannon, I'll just keep these. And I'm like, no, you won't, because they'll start to stink after a while. You won't want these. This is something that I feel like is really important for you to be proud of. And if you don't really have, someone that can train you and teach you, that's what we're here for. Tonight is just a short little bit of what we're doing, but I can tell you that there's a lot of courses out there, and I want to encourage you to learn more. Take it upon yourself to learn, because nobody's going to invest more in you than you. And I mean that. And so today, after we were putting this together, we're doing a course that we're actually going to be doing live with GC. And this is going to be the first of its kind. It's going to be 2 days of provisional trimming, where you really learn everything we really need to learn as dental assistants, but most importantly, learning more about trimming these provisionals, because I can't say enough about investing in yourself. It's going to be in Chicago at GC's office. And this is where you really and truly will learn, and we don't have very many hands-on courses anymore, right? Due to COVID. Thanks a lot, COVID. But most importantly, where are you going to go and get 2 full days of courses? And I can tell you, with classes like these that Viva is allowing us to do, and just really and truly looking at there's so many speakers on Viva that have done provisional courses. I really encourage you to listen to them. Leanne Brady, Frank Milner, so many amazing clinicians that are teaching provisional courses here. Take each one of those courses and take 1 or 2 things from those classes to better yourself. But practice makes perfect. Remember what I said, when we would trim one, if we can make another provisional to practice on, we were doing it, because this is not something you're going to learn overnight. This is something that's going to take time. And I want to be there for you. I want to help you in so many ways. If you need information about the burrs or how to get these products, let us know. And I am definitely here for you. And if there's any questions that I can answer, please feel free to reach out to me. And if there's any questions that we have not answered for you, please feel free to ask away in the chat box here. And I'm just appreciative of everybody being on the call tonight. I know it's been a long week, and thank you again to GC America for letting me talk about a great subject. No questions? All right. Remember, burrs from Brasseler, provisional material is Tim Smart from GC, the cement, GC. Remember that, try out provisional material, try polyvinyl. You can pour it multiple times. Those are some great things to think about. Thank you so much.